Good afternoon, everyone. I'm Dr. Singh, and I'm here with Dr. Alfred Hauk.
Good afternoon, or whatever time of day I guess you'll be watching this video that we're making, right?
That's right.
Yes.
That's right. Thank you, as always, for sitting down for a few minutes.
It's my pleasure.
For the benefit of the people watching, I'm sure a lot of people are already aware of this, but how long have you been in practice for?
I started Holistic Healing Arts actually in February of 1992. Now, I did graduate from the Canadian College of Naturopathic Medicine in the summer of 1990, wrote my licensing exams, and then it took me a year to get all my ducks in a row, and that's how long I've been practicing, since basically February 1992.
And the first place where you practiced, where would that have been?
Well, I started, I've been in Brantford my whole life practicing as a naturopathic doctor. I started with a small room, actually about the size of this little room here that we're videotaping in the basement of a hair salon on 130 St. George Street. And people would come in the side door, literally sit on the steps to go down the stairs to wait for me if I wasn't ready to see them. And I did it all myself. I would just see the patient, write the receipt, make a new appointment, and then escort them to the door, and hopefully there was another person waiting on the steps to come in and see me again. So I did that for about 6 months, 8 months, and then I moved to the second floor of that hair salon, where we now had a couple of small rooms, and then I actually hired a part-time receptionist to help organize my files and kept things going. Did that for about another year and a half, then moved to Charing Cross. So over the last 27 some years, we've slowly been able to grow and be able to get some good people to work with me. That's made all the difference.
No, it's amazing. It's remarkable, and I know I've told you this before. You definitely are a true pioneer of naturopathic medicine in Brantford, and to see what you have created in these last 27 years, and now this clinic at 274 King George Road,
that's right, yes.
Holistic Healing Arts Center, it's phenomenal. And I think anyone who comes into this space, they always comment on how welcoming our clinic is and just how spacious it is. How we always hear positive remarks about that.
That's good. Well, I have to say it's all about creating a good team. I mean, Dr. Singh, you've been working with me for, getting close to
almost
20 years.
19
years.
Almost, yeah.
We've had some of our front staff, Vanda's been with us almost 19 years. It's a great team. We've got 5 naturopathic doctors, we've got some great staff, we've got an osteopath, we've got a nutritional consultant, and we've just added another 6 treatment rooms to our clinic. So
that's right.
We're going to be adding reflexologists, some massage therapists. So it's an exciting time. I think we'll be able to do some good work here.
Awesome. What types of cases do you see in your practice?
Over the years, I think I've seen a little bit of everything. I didn't focus on anything in specific. I've been pretty eclectic. I see a lot of families. One of my wonderful things that I get to see now after 27 years is I'm having young moms and dads coming in with their children who came in to see me 20 years ago when they were, even a preschooler. And that's kind of cool, that you can see sometimes 3 generations of the same family, and you've played a role in them figuring out how to maintain their health and prevent disease and put the pieces together that are really what naturopathic medicine is all about.
So very much an eclectic practice, very diverse in terms of what you see coming into your practice.
For sure,
Yeah.
yes. I haven't focused on anything in specific, and as a as a general naturopathic doctor, you tend to just have a kind of a family type practice where you're seeing anything from pregnant moms and babes and older people and everything in between, husbands and wives, and yeah, it's been a remarkable journey. I'm enchanted that I can walk down the street and there's people who say hi that I know that I've been able to help.
Absolutely, yeah. And as you said, it is cool that now you're seeing patients that you used to see when they were younger or in preschool. Yeah. Now they have their own families, and you're seeing their children.
That's very, very cool.
That is. I totally agree. Why should someone even consider coming to see a naturopathic doctor?
I think naturopathic medicine has a really important role to play. I mean, there's no doubt we live in an exciting time in terms of our crisis care, in terms of the things that we can do if we have a heart attack or if we have a serious pathology like cancer. But at the end of the day, in spite of all of these marvelous medicines and drugs and pharmaceuticals that we have, we aren't really as healthy as we really should be, given the circumstances. In fact, I was just reading an interesting report. In the last 3 years, the longevity of the American people in the United States has actually declined substantially. And in Canada, we're a bit more fortunate, but nonetheless, when they look at this research in Canada and the States, they're looking at things that are often lifestyle related. Some of it is unfortunately real crisis issues, like the opiate crisis, for example. But a lot of it is real lifestyle stuff, like alcoholism, obesity, nutrition, poor diet. These are all things that actually naturopathic doctors can really have an important impact on. People should be coming to see a naturopathic doctor before the crisis hits, and be working with a naturopathic doctor to help put the pieces together. Sort of help people put their owner's manual together in terms of their lifestyle, their nutrition, their diet, the strategies that they need to pursue to maximize their good health. It's all about disease prevention and health promotion. And many people say they do that, and many people do that. But I think as a profession, naturopathic medicine is uniquely positioned to do it really well.
Yeah, totally agree. And as you said, it's very individualized from one person coming into another.
Yes.
It's the preventative aspect, as you said. And you always speak about this, which has always been inspiring to me personally, is we have this role where we are able to hopefully inspire and get people and patients to take ownership of their own health, to take responsibility.
Yeah.
Right?
At the end of the day, and I tell people that, I say, what we do to you today, whether we're doing an IV therapy or I'm giving you physical therapy or acupuncture or anything that engages me with touching you and communicating to you directly, that's really important. But at the end of the day, where you're going to be in 5 years is 80% predicated on what you can do for yourself. And that's my job, is to help you help yourself. I think there's a movie that talked about that somewhere. But let me help you help you,
I think Tom Cruise said
something like that. So and that's really our game, is to help people put their owner's manual together and put it together in a way that they can do it, rather than give them unrealistic targets and goals, but really work walk the talk and work the process together. And I think we do a great job. It's we do great things generally. We do IV therapy. You do IV therapy. It's just magical what it can do for people. I do a lot of physical therapy. I do a lot of sports medicine. But really, at the end of the day, the foundation is helping people put their owner's manual together in a way that works for them. And it's huge. It's more of that has more of an impact on our quality of life and our longevity than really we give it credit for. It's really the key to it all.
Wonderful. The last sort of area that I wanted to touch with you on was, we are seeing some exciting types of things coming in where someone is just coming in as a disease prevention. You know what? I'm generally healthy, generally eating well, I'm doing my exercise, I understand about stress management. Are there 2 or 3 vitamins and or supplements that I should be doing in addition to my healthy lifestyle? And I realize this could be a more involved discussion, but what would be your advice for sort of that paradigm?
Yeah. I mean, there's some basics that I think that are important. There's no substitute for a good diet. There's no substitute for eating right, for acting right, for just doing the right things. People, if they had a dog, they would make sure that it got out and exercised it, but yet they don't do it for themselves sometimes. So yes, lifestyle, diet, there's no substitute for that. In terms of supplements in this day and age, I think there are a couple that keep coming up. And again, it's not necessarily exactly for everyone, but I would say many people would benefit from some simple basic supplements. One is, and this is in no order of importance, magnesium is a very common deficiency, just not by naturopathic testing, but by just the regular medical establishment shows that magnesium is a mineral that is very deficient in our modern world. And it plays a huge role in managing our muscles, our tension. It has a mild antidepressant effect. It's a vital player in glucose regulation, which diabetes in this era is humongous. Magnesium plays a role in all of those things. And it's not as abundant in our diet and the way we prepare our food as it should be. So that's a really important one. I think vitamin C is very important. A lot of people don't realize that all mammals on Earth make vitamin C in their liver, except humans, fruit bats, guinea pigs, monkeys, and apes. Interesting little, piece of information. And they make a lot of it. A 100-pound goat or rat or rabbit will make 6,000 to 8,000 milligrams a day of vitamin C. That's a lot. That doesn't mean we have to necessarily eat that much, but it does suggest that there's a role for it to play as a macronutrient rather than just as a micronutrient to prevent scurvy. So vitamin C is very important. And those two, and then I think omega-3 fats, especially fish oil, it's high in a fat called EPA. We don't get enough of that in our diet, partially because we don't eat as much grass-fed chickens and pigs and cows and animal products like we used to, and those all had a minute amount of omega-3s in them. They don't today because they're all grain-fed. So there's some subtle differences in our nutrition compared to our grandparents, and we can compensate for that with some good supplements. So those would be three that I would be looking at. There's a few more, but you have to customize the program.
Of course, yeah.
Yeah.
But based on what you're saying, magnesium, vitamin C, and your omega-3s.
Fish oil. Yeah,
yes.
Yeah.
Well, thank you once again for taking the time to have this chat.
Oh, you're welcome. Our minutes are up already, are they?
They are.
Holy nine,
It's amazing how time flies when you're having fun, right? So thank you for everyone tuning in. And if you are looking to improve your health, having someone inspire you, to empower you to take charge of your health, Holistic Healing Arts is your answer. Call today, book an appointment, and see one of the great clinicians here. Thank you.
Thank you.